everybody. I'm here today with Dr. Edward W. Pearson of the New Medicine Foundation, and we are having a discussion about insurance. One of the issues that I have been facing lately is clients, individuals, trying to justify their paying insurance. And for me, as an advocate for change, it becomes a bit frustrating. As I'm sitting here talking to Dr. Pearson, it's also frustrating for him as well. So I want to kind of take this conversation today in the direction of why we're not handling insurance, and how we can start to get clients in a different frame of mind, I guess, Doc, is a good way to put it, because they're really geared toward making use of these payments that they're paying to these insurance companies every month, thinking that they're saving money or thinking that they're utilizing a system to their advantage, when in reality, in my opinion, they're not. I think that in the long run, they end up doing more harm than good by continuing to try to work within a system that is broken. So I don't know if you want to just start talking and dialoguing about this and kind of give us your thoughts about it.
I think a good way to explain it is think about some of the generational changes that have happened in the last 20 or 30 years. I know when I was a child, when I would go see a physician, we would pay the physician, and my parents would receive a bill, and then it was our job to submit that bill to the insurance company and get reimbursed for what we had spent. So the doctor wasn't working directly with the insurance company at all 30 years ago. What's happened, I think a key part of the plan to kind of corrupt the system was to shove the doctors in between the patients and their insurance. Yeah. So doctors weren't really contracted workers of the insurance companies 30 years ago. Now, well, for the most part, they have been, and the worst aberration of that system is the HMO system, where the doctor, everything he or she gets paid, and their profits are solely dependent on how well they work within the HMO. They work only for the HMOs. But really, everybody has gotten used to this framework now, where they want their doctor to handle all of the insurance work, when that's not really the way it should work. The patients hire the insurance companies. The insurance companies work for the patients. It is a relationship between them. And what's happening as the system fails, because the care has become so poor in order to make more and more profits for the insurance companies. So the doctors get paid less, the patients get less care, worse care, and the insurance companies make more money, and the drug companies make more money, and the entire system is created to make them more money. As this continues to fail, doctors are running from the system. So doctors more and more want to get out of the system the way it is. They want to get out from under the insurance company's kind of grip. They want to stop having to not only practice the kind of care the insurance companies want them to practice. They know they don't want to just prescribe drugs all the time. They don't want to spend all of their days and have a staff of 5 or 10 people handling insurance forms and insurance codes. They don't want to think about their patient's health in the terms of codes. We don't think that way. A patient is not a code. A patient is not even for us a condition. A patient is a patient, and we're looking at their entire body as far as their health. So what's happened is people have really been trained to expect doctors to work within their insurance. That's how we've been trained, and that whole system is failing. And it's failing to the point that Medicare is bankrupt. I mean, the whole Medicare system, which is really the highest governmental one-payer, socialistic kind of part of the system, is bankrupt. It's not working. People are getting horrible care. Doctors are making no money, and Medicare itself is broke. It's just not working. So, in order to practice good healthcare, it has to be a relationship between the physician and the patient. There has to be an amount paid for the service. The patient is then, as you say, has skin in the game. They're paying for their own health care. They're choosing who they want to go to. The doctor can provide the care that he or she wants to choose. And if there is a health insurance company involved at the choice of the patient, then the patient will take that expense and go and tell their insurance company, this is what I paid. you should reimburse me. And that's how it should work, and that's how it used to work, and that's how it's heading back to working, because as soon as they try to put the doctor back in the loop and say, you know, well, the doctor talked to the insurance company, then you're headed right back into the same place. The insurance company wants you to speak their language. They want to know what codes they are paying for, what service codes were done, what conditions are being treated, what drugs are being used. It doesn't work, it doesn't make any sense. And then all that happens is it gets confusing. They may wind up paying for something, but then they oftentimes want it back. So really the best way it works and how it works for us is our patients come to us. We provide great service at great prices. If the patients want to try to get insurance reimbursed, we will give them some of the standard codes that we don't really use, but we can provide those and a bill, a receipt, and they can go to their insurance company and it will work. But it's that relationship between the patient and their insurance. And the flip side of it, maybe I'll hand it back to you, is the expense that people are paying for their insurance and how expensive it is and how really it's not in their best interest to have an expensive insurance policy.
Right. And that's kind of what, that leads me down the path to the discussions that I have with clients, is that they're so misinformed. You really need an education about your insurance, and a lot of people don't understand the power of an insurance company. And you and I have discussed, you brought this to my attention very early on, that when you diagnose somebody through a code, you have labeled them, you've branded them, and it's a brand that can stay with you for life. If they find out that you've got, if you label them with pre-diabetic number or depression or whatever, this insurance company is going to look at you, and later on down the road, that's still going to stick with you. Even if you're no longer in that category and you've gotten well and better, you become this risk to them and try to get insurance, or even, let's say a home or a mortgage. They can use that against you. Gosh, this guy, is on the verge of cancer or whatever. Let's not. He's a health risk. We don't want to stick with him. That's the sad part of it. The other side of it is the expense. People are saying, well, I have this insurance and, I want to work within that realm because I've got this insurance and they're going to pay for it. Well, no, you're paying for it. You really are. If you've got a $600 a month insurance policy and they're dictating what they're going to cover and not cover, whether your employer's paying it or it's coming out of your pocket, it's ultimately coming out of your pocket. I don't care, it's $600 your employer is paying for you that ultimately could be in your pocket. My stance on the whole thing is that for years, insurance never covered my treatment. Even when I came over to New Medicine, they always had an excuse. So I opted, when I went with Dr. Pearson and saw and experienced the health and the wellness that I experienced, I went and pulled back my insurance. I got a catastrophic policy for next to nothing, I don't know, $100 a month, whatever it is. And I took that difference and threw it into a bank account, tax-free, under the health savings account plan, and anything that I get from Doc can then go through my health savings account. And at least I'm paying with pre-tax dollars. And I'm taking the money that I used to give to an insurance company, and I'm in I guess, in reality, really self-insuring. But I'm no longer sick. The catastrophic illnesses, I loved when I started working with you and you brought to my attention that insurance is really ensuring that you'll be covered for something that's going to happen in the future. And so it's ensuring that you're going to be sick and that you've got some money to cover it. Here's the flip side to that. This was, for me, the biggie, was I have friends that went through the system. And one friend in particular, her husband had the beginnings of some kind of a cancer. He got approval from the insurance company to treat this cancer, to treat this condition through this avenue, all approved by the insurance company. What they didn't know is that insurance companies have a 2-year clause. So if during the treatment that they've approved and they're paying for the hospital or the doctor, through that treatment, they've got 2 years where they can go after that doctor or the patient and reclaim those dollars that were spent and say, you know what? we either changed our mind or we're not agreeing or this procedure is no longer approved, we want our money back. And it's actually happened to the tune of about $150,000. And over the course of a treatment plan that lasted about 9 months. They had to hire an attorney to defend them. The doctor had to hire an attorney. The hospital, who also got some of this money, had to hire an attorney. And so all these people, it's no wonder that hospitals and doctors don't want to get in the game of insurance anymore. And the downside again is who has all the money? It's the insurance company. Who has the high-priced attorneys and can go after you? The insurance companies.
That's how they've gotten so powerful, and really it's all in the name of corporate profits.
Right.
And it's the number one reason, and it's a huge reason in addition to the expense of the pharmaceuticals that we all supposedly need and the surgeries that we all supposedly need, as we're all led down a system that promotes sickness and managing sickness and all this stuff. It's why healthcare costs are increasing at an unsustainable rate. It's 7 to 10% a year. It's going on an exponential curve. It's bankrupting the entire country. So all parts of it are unsustainable. The healthcare industry is a $3 trillion a year industry. This is why. It's the insurance, it's the patients not getting good care and getting sick care and staying on meds, and all of the profits going to the insurance companies and the pharmaceutical companies and all these things. If you simply just get healthy, reduce your insurance to catastrophic, invest a few $1,000s one time to get healthy and learn how to stay healthy, you remove all of that extra expense. Doctors don't have to have the insurance workers. Insurance companies aren't making the profits. We aren't taking the drugs. We aren't getting the surgeries because we're healthy. And our theory and what we see is that you can remove at least a third of that expense. So we're talking about removing $1 trillion from this wasteful system. And it's all about getting healthy, reducing insurance, not relying on your insurance, not thinking that you have to go do what the insurance companies tell you. You need to make your own decisions, get catastrophic coverage, pick a good physician, get healthy, spend your money wisely, and learn how to live sustainably and not waste all of this money. It's the number one reason why the economy is the way it is, both in this country and in a lot of modern countries. We are the sickest country in the world. So this is all part of the answer. And it begins with taking responsibility for your health and getting healthy and learning how to stay healthy. And that's what we do. And it's very easy and really inexpensive. And it pays you back 1,000-fold as you don't get sick, you don't take medications, you don't have expensive insurance policies. And the end result that we're kind of debating now in this country is whether we go to a socialized medicine system, and that's not the answer either. Obviously, with Medicare going bankrupt and people getting more and more ill, the solution is not to have the government decide our health care.
Right.
It doesn't work. They'll ration care. It will be poor care. It will be care based upon the same faulty care system that we're following now, following corporate profits, pharmaceutical profits, all the things that are lobbied for in the government. That is what will be used to keep really filling their pockets. So that's not the answer. It's obvious to me because it's already bankrupt. So the answer in both restoring health and sustainability in the economy, I think really a huge part of it begins with our own health and our decisions about how to do that.
Right. Well, there's not a whole lot more to say. I'll close this clip here with just saying back in the 60s, it comes back to food again also, let thy food be thy medicine. And that's part of what we teach at New Medicine and through Voice for Change. And I just want to remind everybody that back, I think it's in the 50s and 60s, we spent 18% of our disposable income on food. And I think it was 9 or 10% on medical. And here we are in the year 2012, and it's the flip. And it has been this way for a few years now, to where we're spending 9 and 10% on food and 18% and more on medical. So that goes to show you where we've gone, and that's a sad state. So come on over to New Medicine or to A Voice for Change. Now you'll know why we do not support the insurance system. We'll work with you as much as we can, but it's very, very little. And it's to your advantage that we are like that. We're leading the way here in the March for Change.
Absolutely.
Thanks, Doc.
Thank you.
Thanks for helping us and advising us and for being here to direct us and get us healthy. Take care, everybody.